Good afternoon. This is the number 5 lecture about the clinical nutrition of dog and cat. We will have number 5, this one, and final number 6. And where are we now? We are in the third field of clinical nutrition, namely dietary management of clinical diseases and the systematic diseases. From the systematic diseases, we have discussed the urolithiasis, and now we'll continue the diabetes, hyperlipidemia, and the puerperal eclampsy. This is a separate question about the diabetes of dog and cat. This slide should be known for you because concerning the exocrine pancreas I have shown for you. Now we have to concentrate endocrine pancreas activities like secretion of hormones in Langerhans islet cells, release in circulation to regulate the glucose level of the blood. The hormones are the insulin and glucagon as the two most important. The diabetes mellitus is a metabolic problem. It is a trouble of the glucose metabolism. According to the causes and pathogenesis, it can be classified into 4 types. Namely, the type 1 is the insulin-dependent diabetes mellitus. The abbreviation is IDDM. This problem is mostly related to an autoimmune process. During that, the own immune system may damage the pancreatic beta cells, and by this way there will be an absolute lack of insulin. Of course that it will require a daily supply of insulin. The type 2 diabetes is the non-insulin dependent diabetes mellitus, which is associated with the obesity. Why? Because during the obesity the number, but mostly the measure diameter and surface of the fat cells of the adipocytes get larger and larger. The big fat cells will produce more hormones, included the so-called resistin, and the resistin will reduce the insulin receptor sites. By this way, the lack of insulin is relative, and more insulin is required for the same effect. The type 2 diabetes primarily should be corrected by correcting the obesity, but in the later phases it also requires application of insulin. The type 3 diabetes is not so frequent. This is a abnormal glucose tolerance. It means that even in empty stomach the patient has a high blood glucose level. In some cases with the application of organic chromium compound, they can improve the glucose tolerance factor supply and the type 3 diabetes. And the type 4 diabetes is related to the pregnancy and the gestation. Only as a short overview, what are the leading clinical signs, and as a memory helping, CDPPP, CDPPD. This is the abbreviation of cataract, dermatitis, polyuria, polydipsia, and polyneuropathy. First, you have to, maybe the first clinical sign will be a polyuria and polydipsia, and you have to see the other causes of the polyuria and polydipsia too. They are the diabetes insipidus or central diabetes, the drug-related diabetes, the chronic kidney disease, the Cushing syndrome, many liver diseases, the congestive heart failure, the pregnancy and cold exposure are the most important causes of polyuria and polydipsia. Here you can see the illustration of the leading symptoms, like the cataract, right upper corner, the cataract and the eye. You can see the dermatitis once mentioned concerning the biotin deficiency. Be careful. Polyuria, polydipsia, you can imagine, and right, you can see a polyneuropathy. Only for your preparation for the clinics, I show you the algorithm of the differential diagnosis of the polyuria and polydipsia. In case of diabetes, we have to feed a special diet. Which type of feed should be? The first naive approach is many times that we have to give fat instead of carbohydrate. But this is absolutely false. This is not true, because from the fat in the metabolism, ketone body will be produced, which is also dangerous to the health state. So we have to give a low-fat diet, less than 10% of the dry matter. And now you know that the Y related to the ketoacidosis. Concerning the protein, not extra requirement. Moderate protein, 25% for dog and 30% for cat, with high biological value. And this is a very special, high level of complex carbohydrates, up to half of the dry matter. How can you give complex carbohydrates? It means that practically very slow digestible starch in the starch of the maize, sorghum grain, in the buckwheat, and also in the brown rice. Be careful, the polished rice is not enough. And we give a high fiber diet, at least 10%, 10-13% of the dry matter, in order to decrease the rate of absorption of all the nutrients, including the sugar. This is the so-called low release effect. It will result in a less postprandial glucose peak, and we arrive to the key, to the main point, main goal of the dietary treatment and later on hormone supply. We have to avoid the postprandial glucose and the postprandial insulin peaks. Post means that after, pranza in Italian language is meal or festival meal. So after meal peak, because the glucose is absorbed into the blood, and half hour, a quarter and half hour after the glucose peak, by the provocation, insulin concentration also increases. The daily routine at home, how to synchronize the feeding and the possible necessary insulin injection. First, 1/4 of the daily ration from the previously discussed composition should be given in the morning. Injection if only the patient has eaten this meal, because if not, the insulin would drop the blood glucose. The best is if you give a combination of amorph and retard or crystalline insulin at the same time, and the remaining ration should be fed 7-8 hours later, which can be organized, for example, if you return home from your work. You have to control the glucose in the urine or in the blood to regularly correct the insulin dosage. This is the simplified daily routine at home. In hospitalized situation, when 4 or 5 small feeding and 2 injection is possible, of course this is even better. Here is the illustration of this process, the synchronization of insulin injection or injections and the feeding. You can see that the amorph insulin, here you can see and the morning means that we give the 1/4 of the feed and the injection, and the amorph fraction of the injection will quickly give a good blood level, and by this way the absorbed nutrients can be processed in the blood, can be removed from the blood. The black color shows the crystalline fraction of the injection, and you see that this is slowly will elevate in the blood, but in midday there is a good blood concentration of insulin from the remaining part of the amorph insulin, and the increasing concentration of crystalline. You give in the afternoon, 7-8 hours after the first feeding, the 3/4 of the daily ration, and the nutrient starts to absorb into the blood, including the carbohydrates, the sugars, but For that time, the crystalline insulin will give a good blood level to process the glucose. And slowly this insulin level given by the crystalline insulin will slow down during the night, and during the night, after midnight, there is no feeding. The hyperlipidemia is a problem of some breeds. It's an endocrine disorder, meaning that even in fasting state, the total lipid level is high in the blood. You have to use a low-fat, high-fiber diet for these patients. The puerperal eclampsy is not rare in small bitches with large litters. If the bitch milk production is high, in the second, third week of the lactation, the calcium and the magnesium get low in the blood, and these are the causes of the puerperal eclampsy. If we compare with the milk fever of the dairy cow, on the day or second day of the calving, in this case only the blood calcium is low and the magnesium is remained high, and this can counteract the eclampsy of the low calcium. We have to treat using calcium borogluconate IV, and we have to give a diet of high energy density and of course high in calcium and phosphate. Many times the junior pet food are proposed. If possible, you have to wean the puppies and give them solid feed. And now we will overview after the 1, 2, 3 fields of the clinical dietetics, the basic types of veterinary diets. And if you know these characteristics, features, you can find your best in the market. You have 4 or 5 excellent producers in this field of pet food feed. So this is the other approach. Until now you have heard that which disease, which basic type of veterinary diet, and now we will summarize according to the diet types. Low-fat diet, colitis, diarrhea, exocrine, pancreas insufficiency, flatulence, gastric dilatation and volvulus, hyperlipidemia, pancreatitis, vomitus. Low protein diet for the congestive heart failure, cystinuria, liver diseases, chronic kidney disease and glomerulonephritis. Low sodium diet, congestive heart failure and glomerulonephritis. Low residue diet, small indigestible organic matter for, in the case of coprophagy, flatulence and malabsorption. The high energy dense diet was mentioned previously for the puerperal eclampsy and also gastric dilatation and volvulus. High carbohydrate diet for the pancreatic patient in case of diabetes mellitus. This carbohydrate should contain a lot of complex carbohydrate. High fiber diet, hyperlipidemia, obesity, diabetes, obstipation, coprophagia. Restricted energy diet, or if they are American company's restricted calorie diet, sorghum starch instead of fiber, anti-plaque against the tooth-stone diet, joint diet, senior diet, cancer diet, relax diet, hyperthyrosis diet, and sensitivity diet, and practically every year you have a new one. And we arrived to the number 4 field of the clinical nutrition, and these are the special physiological circumstances. It means that it is not a obligatory disease, or pathological state or extra requirement. What is common that the normal healthy pet food is not enough. To the feed allergy. The feed allergy is a civilization disease because the animals in the wild life cannot develop a real allergy. This is a civilization disease. The main attacking points are the digestive system, more or less with diarrhea, and the skin and the mucous membranes and the bronchi too. So you can see that we have to make differences in the definitions. Here you can see a lion, so I'm sure that no allergy at all. So the first similar situation which can cause diarrhea and sometimes skin problems is the feed intolerance. And even in some excellent textbook, all the topic feed is called feed intolerance, included the allergy. But the best approach is that we have the feed intolerance, which derives from a objective physiological problem like lack of an enzyme. Lactose intolerance derives from the lack of sufficient lactase activity. So this is not like the feed allergy, which is in the center now, is a allergic reaction. So it means at least 2 meeting with the allergen, which is more or less contains a protein part, and the second meeting will cause an allergic reaction. This is a over answering of the immune system. So this is immune related problem, like the gluten allergy or many others. I would make a hint to the non-infectious abortions that the feed allergy and the inhalation allergy may contribute to the development of the abortion. And the third is the feed aversion, which is mostly specific and characteristic for the cat. It means that the physical form and the taste of something, feed or medicine, made a refusal in the animal. If you give the same foodstuff or chemical compound in another form or covered with a jelly, they will eat it without any aversive symptoms. The most important in the differential diagnosis of the allergic skin problems is the flea eczema, which is caused by the flea saliva, and this is similarly to the skin problems. May cause a loss of hair. This is symmetric on the body. You can see on these pictures, or these are the first and second flea eczema, and very similar if you see alopecia caused by feed allergy, allergic skin reaction. This is the abdominal part of a cat, and this is of a dog in a supine position. We have to deal with the Irish setter gluten sensitivity, which is a breed-related genetic problem, and the attacking point is also different. This is a small intestinal inflammation and not a large intestinal, so we have to exclude from the further discussion. The feed allergy will cause very typical lesions in dog and cat. In the dog is very typical the previously shown abdominal and inguinal part, and the interdigital skin is very sensitive, irritable, and painful. In cat, the lesions are mostly on the head. You can see here the lesions on the head of the left, in the left picture, or secondary processes after self-scratching. The crust building is also typical in this cat. The mucous membranes are also in inflammation, in allergic reaction. You can see here a conjunctivitis, and which is common and typical, this is a lymphocytic plasmacytic enteritis. You can see here a villus, and around the rim you can see this series, this line of dark points. They are the nucleus of lymphocytes and plasmacytes. The dietary treatment of the allergic skin disease starts with an feeding of an elimination diet. It is highly important to cure the problem and to know the cause of the problems. So we will give a elimination diet which consists of two sources, an energy source and a protein source. Both should be more or less unknown for the animal, not the previously used feedstuffs should be used. For example, we can use rice and absolutely unknown meat for the animals, like the horse, like rabbit meat, with one carbohydrate sources, boiled potato or rice or so. After the cure of the clinical symptoms, we have to make a diagnosis. Of course, you can make or try to make a diagnosis by scarification test, but this is limited number of test materials. From the blood using ELISA, But the practical approach is a challenge that you start to replace the protein source, the meat, with previously used protein sources. For example, chicken meat. For example, fish in case of the cats. And if the skin lesions return, you can state that this was the cause of the allergy. After that, you have to give different allergic diets of at least two different types. One types are the selected protein diets for allergic dermatitis. It means that the previously mentioned elimination diet is made commercially, industrial scale. The first used to be the lemon rice, containing only lamb, meat, and rice. Or today's is very typical, very interesting is the duck meat and tapioca. Duck meat for protein sources and tapioca for carbohydrate energy sources. Another type of this dietary treatment to use hypoallergic veterinary diet. We have two subtypes of this hypoallergic veterinary diet, but the basic is that there is a enzymatic pretreatment of protein, and this pretreatment will split the protein molecules, and the residue will be not higher than 16,000 Dalton. But the second subtype is only some Dalton large. And in this case, even very aggressive protein sources can be fed because they have lost their antigenic character. And to finish this dietary treatment unit with a picture that the two dogs are speaking to each other, and this spotted told, no, it's not an allergic reaction to soy antigens. We Dalmatians have spots. But you can remember that the non-treated soybean protein is a strong allergen, really. It was the so-called hand rearing of kittens and puppies. And the question arises, why hand rear a puppy or a kitten? The reasons and the causes include the death of the mother, separated or abandoned puppies or kittens, too many newborn or large litter size, and or lack of milk production by them. Behavior of both lactating mother and their offspring is affected by a protein deficient diet, and signs of these protein deficiency are vocalization and movement in the home box are both higher in sucklings whose mother are not receiving enough protein in the diet, and the nervous movement of the mother. And also the nursing behavior can be abnormal in those bitches and queens too. What we have to recall from the milk composition of dog, cat, and cattle, and maybe goat. But first we have to see the Bunge-Abderhalden rule. Bunge-Abderhalden rule told that the concentration of the milk is species related, and the growth rate of the newborn positively correlate with the concentration of the milk. The applied Bunge-Abderhalden rule is that the milk replacer should imit the original milk composition as close as possible. You see that dogs has the more concentrated milk in the dry matter. The cat is in the middle, and if we compare to the everybody's known cattle dairy cow milk, the protein is at least 2.5 times higher in the dog and the cat, and the fat 3 times 2.5 in the dog, and 50% higher in the cat. The lactose is extremely high in the cat, and what we have mentioned, the copper content is characteristically different, sufficient in dog, few in cattle and goat, and too much lot in the cat. And based on the applied Bunge-Abderhalden rule, we can put together homemade milk replacer for orphan puppies and kittens. So this is the homemade replacer. Left column are the puppies, and the right column are the kittens. The components. Of course, we can use as a basic skimmed cow milk, but in case of possibility, goat milk. This is the basic. And we have to increase the protein, fat, and mineral vitamin content. You see that for the puppies, for both, we can use cotton cheese, low fat. You can use for the cat lean cattle meat, scrambled. For both, cooking oil, preferably soybean or rapeseed and not sunflower, egg yolk, and because of the high lactose level in the queen's milk, lactose for the kittens, vitamin mineral mixture, and the daily portion from this mixture is 16 milliliter per 100 gram live weight of puppies, and 25 milliliter per 100 gram live weight for kittens. At least we have to apply 6 to 8 times to imitate the natural frequency of suckling. After suckling, we have to make an inguinal massage to replace the mother's tongue, because without that the urination and the defecation of the newborn is not possible. It was mentioned that the goat milk is preferred than the cow milk as a basic of this homemade milk replacer. Why is goat milk better for kittens and puppies? In the cow's milk, the casein has a relatively large molecule mass, difficult to digest, and the likelihood to provoke allergic reaction is great. The fat found in goat milk has a very good composition of short and medium chain fatty acids with a good digestion and absorption rate. And the fat droplets in cow milk are about 5 times the size of those of goat milk, which also contribute to a better utilization from the goat milk. And the other side should also studied. Why should cow's milk be avoided? Yes, please remember to the copper content and other minerals, especially kittens reared solely on cow's milk are prone to develop skeletal problems such as spinal kyphosis and lordosis, lack of copper. I will show you some pictures, but before that, some, not 5, but some milk replacer from the market ready to use them. For example, you have the milk replacement option for puppies, the lactol, the essential pet with colostrum, and the puppy milk. I'm not intended to be comprehensive, of course. And you can see for the kittens, the kitty milk formula or goat milk and goat milk powder. The possible deficiency syndrome, especially in kittens, I recall from the lecture 1, this is a graying and alopecia and leg deformities, copper deficiency, and potassium deficiency, stuff muscle can occur. And here is the X-ray picture and the clinical picture of the spinal cord problem. And now we'll continue the orphan fall and the raising of the fall. Finish today, the orphan fall should be discussed too. In the spirit of the applied Bunge Abderhalden rule, we have to make a mixture which is similar to the mare's milk, which is highly diluted but contains more lactose than any other domestic animals. So we have to make a mixture, 600 milliliter daily milk and 400 milliliter water, and we have to replace 35 gram milk sugar if possible, but any other sugar can be used. The daily portion is for up to 9-10 liter per day, given each 2-3 hours. This is not the same than the 60 suckling of the mares, but even possible by this. The more frequent, the better. To improve and replace some vitamin B and a little bit alleviate the essential amino imbalance, you can give 2-3 raw eggs per day. The whole mixture can be based also on skimmed milk. Avoid saccharose because in the sugar, because it can cause diarrhea. So the best is the milk sugar or possibly glucose. One example, once more, without claimed to be exhaustive, only one that we have a ready to use pull powder. The creep feed or pre-starter for suckling foal is oats calculated in liter according to the age of the foal. Liter oats multiplied by the number of months per day plus good hay. There is also a allowance hypertonic IV solution in case of necessity for total parenteral nutrition TPN of foals, and amount per day for 45 kilo of live weight is approximately 3 liter. And here you see that amino acid solution, dextrose, potassium chloride and sodium bicarbonate with complex vitamin. And finally, I will show you a problem which can occur if the milk replacer is not optimum. Among others, developmental orthopedic disease DOD can develop. And thank you very much for your attention.